Does your skin look like this? Or have you seen skin that looks like this? After watching today's video, you're going to discover how to recognize conditions that are similar to contact dermatitis or eczema, sometimes called atopic dermatitis. You're also going to learn some of the main strategies that dermatologists use to help improve these conditions. Let's look at this first example on the ankle. When you look at this ankle, you see that there's a large fluid-filled blister on the surface. Sometimes we dermatologists call these larger blisters bulla, and we call the smaller multiple blisters vesicles. These patients often complain of severe itching, and doctors will often think of bug bite as a possible origin. Really, when they present, they will consider diagnoses similar to contact dermatitis or bug bite, sometimes called arthropod bite. Some of the main treatments to consider doing in the office include taking a 15 blade and puncturing the surface to release a lot of the fluid. Also, we inject the base with Kenalog anti-inflammatory solution. Helps the inflammation on the surface and some of the deeper parts of the skin. Also, some doctors will use cold liquid nitrogen spray just to add more anti-inflammatory effect. Some of the things that you can teach the patient to do at home to keep themselves busy will be triamcinolone 0.1% cream or ointment used twice daily, loratadine antihistamine by mouth twice daily, and prednisone 5 milligrams taken once per week, unless of course the patient has a risk of diabetes, in which case you would hold the prednisone use or limit its use to a one-time dose only. Let's look at another example on the same patient. As you look at the back of this knee, you can see some thick, very red inflamed skin on the crease of the leg. If you look lower on the leg, around the calf, you'll see some discrete red bumps, and these look similar to contact dermatitis or eczema, sometimes called atopic dermatitis. They really look very similar on physical exam. Some of the key diagnostic tests to use and differentiate the two may include things like food sensitivity tests, environmental allergy tests, and probably biopsy analysis is the most important in making a definitive diagnosis. Some of the in-office treatments that can be done on patients like this will include intralesional steroid injections. Also using cold liquid nitrogen spray on the surface just to cut down on some of the inflammation. Some of the things that can be done by the patient at home will include a higher potency topical steroid, such as fluocinolone 0.05%, used twice daily, an antihistamine, loratadine, twice a day, and prednisone 5 milligrams, which can be taken once a week, unless the patient has risk for diabetes, in which case you may hold the prednisone use or limit its use to a one-time dose. I'm Dr. David Bryant, the proud owner of world's famous Dermatologist, a dermatology practice in Stockbridge and Decatur, Georgia. We help patients of all races and ethnic groups, but our expertise is probably best known for what we do with black skin. Your dermatologist does not need to be a black American like myself to be considered an expert with black skin, but they should have experience with a lot of black skin conditions and a large volume of patients that have black skin. 3% of the dermatologists in the U.S. identify with being black American. In my opinion, that's a relatively low fraction considering that almost 1/3 of people identify with being either black or brown according to race or ethnicity. I hope you enjoyed today's video. If you did, please like, comment, and subscribe to the channel, World's Famous Dermatologist. I'll keep your comments in mind if we cover similar content on future videos, and I look forward to connecting with you on the next video.